The students who are on government sponsorship, say in Makerere, in Mbarara, in Guru, Kabale, those who are on government sponsorship, we proceed on internship with full support from the government. There's no disruption.
The contest between medical interns and the new policy from the Ministry of Education is not about to end. As the current cohort of medical interns prepares to complete training at the end of July, concerns are mounting over the new government policy that would overhaul medical internship and training.
By government saying that they want to extend by a 6 year. Who is Minister of Health? When we were signing contracts with the universities, Minister of Health was not there. So that would be a breach of contract between the university and the students.
Intern leaders say the reforms could leave hospitals understaffed and disrupt service delivery if incoming interns are delayed. According to the Federation of Uganda Medical Interns, interns currently provide a significant portion of frontline services in referral and district hospitals across the country. The interns are particularly opposed to proposals that would integrate internship into university training and potentially extend the period before graduates qualify for full practice.
You cannot keep somebody who is a student to work as a qualified personnel. We have licenses. How do you license a student? How? And to do what?
They argue that students enrolled under existing academic programs signed up for a 5-year medical degree followed by internship, and that changing the arrangement midway would be unfair.
What is the guarantee to this student who doesn't want to practice in the future? Because they can tell you, I studied medicine, yes, I'm doing internship because I want to practice it. I have classmates I finished with who went to do business studies and become managers somewhere. They use this as a breeding course. They have not done internship. I have colleagues who finished with me and went to Kenya. I have others who went to USA. They never wanted internship from here, specifically. And others completely don't want internship. After this, others are doing masters in physiology, they will go teaching. They don't want it. So why do you subject everyone to 60 years?
The debate has also reignited concerns over intern allowances. Intern leaders say many trainees continue to face accommodation, transport and welfare challenges despite working long hours in public health facilities. They want government to clearly guarantee intern remuneration and working conditions in any new policy framework.
What was not possible is to pay everyone money because the numbers keep on increasing. And that's why we kept on getting strikes to every year because the money would not be able to. Even now, I don't have enough money to pay these interns that are finishing. We are waiting for supplementary to give them, even that little money. So we are simply saying, let the person, the entity that has been taking care of you continue at least extra 1 year.
At one point, it says Uganda's current population is around 45 million. If we are to meet WHO standards, that means Uganda should be producing 45,000 health workers per year. Currently, Uganda is producing 20,000 health workers per year, which means even if you double the current medical schools and nursing schools and midwifery schools, you will make 40,000 per year, which is still 5,000 less than the recommended. So the issue of numbers should not be an issue because we are way below the numbers we're supposed to have. As we talk, one doctor has to treat 25,000 people, but is that feasible? At the beginning of our internship, we signed contracts with Ministry of Health through hospitals. And each of us was to receive 1 million shillings per month. And I agree with you, you can also attest it that 1 million for survival is very little money. But I can assure you, even after signing those contracts, Ministry of Health went ahead and said people who are on government payroll but doing internship now shall not receive the allowances. We asked what is the basis of removing these allowances. There was no reason.
So as a ministry, we shall sit and now look at the lunch facilitation for those who are sponsored privately to enable them to continue with internship. So we shall resolve this issue of internship. It should not be a very big challenge.
During school, your mother provides you money that is enough for you to go back home and cook, because classes end at 6 p.m. You go back home and cook supper. Internship does not end. You start working at 8 a.m. Up to the following day, 8 a.m., you have to hand over a report. Then by around 2, that's when you are going to rest. When will you get time to cook? During school, you can even put on your one shirt for 3 days or 4 days. But here you are a doctor. There is no way your supervisor is going to allow you to put on one shirt for the whole week. It is impossible. So the policy in itself is toxic to this health fraternity. Leave alone interns, by the way. The whole health fraternity is at threat, because without it, the health fraternity is down. Interns offer more than 70% of the work in government facilities. And we're talking about government facilities, we're not talking about health center 3s and 2s, we're talking about regional referral hospitals, national referral hospitals, and some district hospitals.
Interns deserve 4 million Uganda shillings. Interns are officers on probation, therefore they deserve 75% of what the officers they're representing earn. For as long as you are treating Ugandans in Uganda, you deserve to be supported by government, not just lunch.
The interns also dispute claims that stakeholders were adequately consulted before the reforms were drafted, saying professional associations, student leaders, and academic institutions were left out of the process.
Consultations were not done. I'm the head of FUM. I was not consulted. My former president was not consulted. Even the former after that one was not consulted. I have been with the president of FUM. You've seen him on news everywhere. They were not consulted. At one point, they lied to us that the previous president of FUM were consulted. The previous presidents themselves said they were not. We were in a meeting with the university deans. They were not consulted.
The controversy comes against the backdrop of a long-running dispute over medical internship financing in Uganda. The Ministry of Health has maintained that rising intern numbers and limited resources require reforms to the training system, while medical associations continue to call for guaranteed funding and broader stakeholder consultation before any changes are implemented. Walter Mwesije, NTV.